Hello. Hello. Welcome to Ashcroft Medical for our first ever Facebook Live event. My name's Matt Dean and I am the marketing coordinator at Ashcroft Medical, and I am the event producer and one of your hosts this evening. Thanks for joining us if you have. It's very exciting. Really glad to be doing this first live event. The event is going to be hosted in both English and Polish. I'm not going to be speaking any Polish. I've got that covered by the people in the room. We have a panel of professionals here to take you through a live question and answer session and a demonstration about the i-PRF procedure. And you can ask us any questions that you might have through Facebook. So please, if you've got any questions at any point, do send them in. The panel this evening, I can introduce you to. I'll show you a quick slide first of who they are in a bit more detail. You're joined by Marta, João, and Alina, who are all going to introduce themselves far better than I ever could. So we will start with João, if you don't mind.
Thanks very much, Matthew. I'm João Ponciano and I'm Head of Medical Service Design for Ashcroft Medical. Glad to see you all here today.
Hello, my name is Marta Kucharska. I'm a cosmetologist at Ashcroft Medical.
Hello, I'm Alina Kujawa. I am a general practitioner and specialist in aesthetic medicine in Ashcroft Medical, Oldham. Thank you.
Great, thanks. So we're here to talk about i-PRF. So before we go any further, I believe, João, that i-PRF is not available in that many places, but it is at Ashcroft Medical.
That's right, Matthew. Ashcroft Medical has managed to secure the exclusivity of quite a number of these very special tubes by Dr. Shukrun, and we will be demonstrating their use today with our patient.
Dzisiejszy pokaz dotyczy zabiegu i-PRF, czyli fibryny bogatopłytkowej metodą Shukrun, i zapraszamy do obejrzenia.
Great. So I think the obvious first question is, what is i-PRF?
Absolutely. I'm sure everybody at home is trying to understand what i-PRF is all about. It stands for injectable platelet-rich fibrin, and the word fibrin is actually quite important in here because the concentration of fibrin is one of the key elements of this preparation, alongside stem cells, alongside white blood cells and platelets.
Fibryna bogatopłytkowa jest to autologiczny koncentrat płytkowy w postaci trójwymiarowej sieci fibryny, w której zawieszone są wysokie stężenia leukocytów, płytek krwi, komórek macierzystych, których zadaniem jest stymulacja odnowy biologicznej tkanki skórnej poprzez jej regenerację.
Now, as we go through the evening, there will be a procedure, and we'll talk in a bit more detail about the benefits of the treatment and how it works, etc. But before we do, what briefly are the most common uses for i-PRF?
As Alina said earlier on, aesthetic medicine and cosmetology are typically the broad areas of spectrum of the use of i-PRF. But to give you just some examples of the detail, we're talking about procedures to the face, hands, neck, and upper chest. And it's also very common for men for the treatment of alopecia.
Zabieg i-PRF jest stosowany zarówno w kosmetologii, jak i w dziedzinie medycyny estetycznej. Zabieg możemy wykonywać na skórze twarzy, uwzględniając czoło, okolice oka, górną powiekę, dolinę łez, tak zwane kurze łapki, bruzdy wargowo-nosowe, a także na skórze szyi, dekoltu, dłoni, jak również na owłosionej skórze głowy w przypadku leczenia łysienia, a także w kierunku wypadania włosów.
Great stuff. So, before we move on to the demonstration of the procedure, we should give a very special mention to Louisa. Hello.
Hello.
Thank you very much for coming along and taking part this evening. Before Alina gets to work with the procedure, you applied some cream to Louisa's face earlier on. Can you just explain what that was for, please?
Sure, absolutely, Matthew. So I think the most important thing to say here is that the cream is applied to make sure that there is no pain when the procedure is taking place, when the doctor is injecting the plasma-rich fibrin into the patient's face, that you feel comfortable about it. So the numbness of the skin is really the ultimate goal of the application of this. You probably can see now Alina is removing some of the excess cream. We've prepared Louisa a little bit earlier from this show just to make sure that by the time that we are actually doing the procedure, she's ready and she won't feel any pain and she'll be comfortable.
Tak więc w procedurze zabiegu zaczynamy na początku od aplikacji kremu znieczulającego, aby złagodzić wszelkie odczucia nieprzyjemne podczas iniekcji. I w tym kierunku tutaj widzimy właśnie, jak ta procedura wygląda od początku.
Great. Okay, well that's good. Let's hope that cream has worked really well and you've got a nice numb face for the rest of it. So the next thing that we need to do, or that Alina needs to do, is remove some blood from Louisa's arm. So what's the first step about, João?
Okay, so what's going to happen now is that Alina is going to take blood through the normal phlebotomy procedure in the same way as you've had blood taken for any medical tests you might have done in the past that's been ordered by your GP or you've decided to actually check yourself. So this is the next stage in the procedure, taking the blood. And to mention, this blood is going to be taken into the i-PRF tubes, not any other tube that may have anticoagulants, just to make sure that we clarify this at this stage. So it is the i-PRF tubes that are going to be used now and they're coagulant free.
Przede wszystkim produktem fibryny bogatopłytkowej jest krew własna pacjenta, dlatego w tym przypadku teraz zostanie pobrana krew i następnie poddana procesowi odwirowania.
Okay, good. So the tubes are important because... Can you explain again?
So these tubes are important because they do not contain any anticoagulant. So there's no thinning of the blood. So all the goodness of the elements of your blood are going to be present when Alina takes the blood, so that this can be spun for use with i-PRF.
Okay.
And so that's the reason why we use this particular technique.
Okay, so that's what you've got the exclusivity on, is these particular tubes which are made specifically for this procedure.
Absolutely. It's the technique here that is important to mention. The technique which was developed by Dr. Shukron and which is in use globally across the world as an alternative for the more conventional treatments, and we will talk about those later on in our event.
Tutaj jeśli chodzi o sposób pobierania krwi, to najczęściej jest to właśnie krew pobierana z przedramienia, krew żylna, która następnie jest poddawana procesowi odwirowania i wyodrębnione są z krwi poszczególne czynniki morfotyczne oddzielające od osocza wraz właśnie z przede wszystkim czynnikami wzrostu, komórkami macierzystymi i płytkami krwi.
Okay, cool. So I'm just going to bring up on the screen some more of the treatments that i-PRF is good for. Obviously, I'm not medically trained, but I believe that skin pigmentation reduction, hair growth stimulation, alopecia, skin rejuvenation, which particular areas is it that generally require on the body, on the skin, and why do they need to be rejuvenated?
I think because over the years our body suffers from stress and antioxidants internally, so that's obviously to combat this kind of process of the body getting older, effectively. That the increased stem cells and leukocytes and plasma that gets injected in the fibrin is of a higher concentration. It helps the body regenerate locally. That's the main effect from a local procedure. And I know, Matthew, you've mentioned some of the examples, but it's also common use in dentistry, in particular implantology, and it's kind of a new technique that some of the more advanced dentists use these days. Just to mention, sports medicine is another one where this particular technique has had some very positive effects, and there's medical research to back up these findings of the benefit. So whilst we're doing this procedure today on cosmetology, but there's wider ample benefits to rejuvenation as well as treatment of medical conditions, including dentistry, as I said.
Skupiając się na dzisiejszym zabiegu, to przede wszystkim właśnie fibrynę bogatopłytkową stosujemy w przypadku typowo procedur estetycznych, czyli przede wszystkim do wypełnienia na przykład bruzd wargowo-nosowych czy kurzych łapek, przez to, że fibryna bogatopłytkowa sprawdza się właśnie super jako autologiczny wypełniacz. Natomiast można stosować ten produkt także w innych dziedzinach medycyny, nie tylko estetycznych, ale również w innych.
So it actually sounds quite futuristic, really, in terms of that sort of anti-aging, regrowth, stem cells. Can you just explain what stem cells are for viewers?
Stem cells are the cells that can be converted into any type of cell in our body, and so therefore they can be converted into things like, platelets or leukocytes and so on. So that's why they're very powerful. They contain effectively the copy of our DNA that can multiply themselves and convert themselves into any cells across the body. They are used in many procedures of regenerative medicine.
Tutaj właśnie produkt jest bogaty w te czynniki wzrostu, przez co jest postać tego produktu dużo gęstsza niż na przykład osocze bogatopłytkowe, więc sprawdza się w naprawdę wielu przypadkach, a jeśli chodzi o tą stronę estetyczną, ma dużo korzyści, między innymi właśnie w leczeniu łysienia, w terapii wypadania włosów, w celu zagęszczenia skóry, poprawy nawilżenia oraz jest super wypełniaczem w przypadku blizn potrądzikowych.
Thank you. So Alina is taking the blood over there. Louisa is looking very calm, very relaxed, so that's good. Far more relaxed and calm than I'd be looking if I was over there.
I think it's important to say, Matthew, as well, that these tubes have got a particular dimension. There's 13 milliliters, so there's a higher volume of blood being taken for the procedure than your conventional hormonal tests or protein tests. The reason for this is that you're seeking to obtain round about 3 milliliters of this prepared i-PRF produce, the goodness of your blood to be injected. So from 13 milliliters of blood taken, you'll get roughly about 3 milliliters of this gold that will get injected back into your skin.
Pobierana krew zostaje odwirowana, przy czym tego właściwego preparatu fibryny zostaje nam niewielka ilość, bo jak widać tutaj doktor przy wkładaniu probówki do wirówki widać, jak duża jest to zawartość ilości krwi, natomiast po odwirowaniu właśnie będzie niewielka ilość tego naszego dobrodziejstwa, czyli fibryny bogatopłytkowej. Pozostałe elementy morfotyczne opadną na dół z tego względu, że są cięższe niż same osocze, właśnie sam ten produkt, który zawiera właśnie wcześniej wymieniane przeze mnie płytki krwi, leukocyty i komórki macierzyste. Więc przy takiej ilości pobranej krwi tak naprawdę pozyskujemy małą ilość fibryny, którą podajemy do skóry.
Okay, so we just saw Alina put the blood into the centrifuge. So what's going on in the centrifuge?
So the second stage, or the third stage we should say, once the phlebotomy procedure has taken place, is that we will centrifuge the blood. The technique of Dr. Shukran is actually that we centrifuge the blood at a lower RPM than we would do for normal blood tests. Why is this? Because by centrifuging the blood at a lower RPM, lower speeds, we actually get a separation of cells into two blocks. The first block is the red cells, which will go to the end of the tube, and we'll be able to demonstrate this once the machine finishes the cycle. This cycle takes about 5 minutes at an RPM of 700. Now, to go back to the physics of this, on a normal blood test that you would send to a lab, your plasma is spun at around 4,000 to 4,500 RPM, which means that there is less goodness in your serum. If it's spun at the speed of 700, there is going to be more goodness. So more of the cells that we've mentioned earlier, more quantity of fibrin, more quantity of white cells, platelets, and so on, are going to be contained at the top of the blood. And this is precisely why the technique is so important and is so successful. Once the 5 minutes go, Alina will have a very short time span to also inject the plasma back into the patient to preserve the quality and integrity of the cells throughout the procedure.
Krew pobierana jest w sposób klasycznie flebotomiczny, czyli jest tak samo pobierana jak do innych badań, gdzie kolejno różni się właśnie oczywiście próbówka, do której pobieramy krew, która zostanie kolejno poddawana procesom odwirowywania. Tutaj w przypadku pozyskiwania i-PRF znaczną różnicą jest właśnie pomiędzy zabiegiem PRP a PRF to, że pozyskiwanie tego produktu odbywa się przy procesie krótszego wirowania i przy mniejszych obrotach na minutę, przez co produkt też jest gęstszy od PRP i właśnie zalecany jest bardziej do wypełnień autologicznych, natomiast dobrą alternatywą jest zawsze łączenie dwóch tych procedur w trakcie jednego zabiegu. Wtedy daje to spektakularne efekty działania tych wspólnych czynników.
Now, Joe, I've seen this procedure being done before, and you can literally see the separation in the white cells at the top and the red at the bottom after the spinning, and it's then there's a short period of time so that the two don't mix together again. That's right?
That's right. That's precisely what it is. We don't want to mix the red blood cells with the other cells that effectively are going to be playing a key role in the rejuvenation of the skin. The red blood cells do not play a key role in this process, and this is why it's very important that in medical terms we say that the sample must not be hemolyzed. That means the sample must not be contaminated with the red blood cells. Okay, so that's actually one of the main objectives excuse me, of the centrifuge, and it's exactly doing that separation at high speed. High speed means that force of the heavier cells go to the bottom of the tube and the lighter cells will stay at the top. In this case, the lighter cells are exactly what we want to inject back into the procedure.
Very good.
We are almost done.
I can see that we've got 20 seconds nearly to go, and then we can take it out and we can see what the results are, and they can be injected back.
And the goodness of a procedure like this is that patients can literally go back to work straight away. I mean, they may not look their best, but you are still comfortable. You know, it's not painful in any way. But yes, of course, a period of rest is always advisable, but it's not that you can't continue your daily life. That's the end of the centrifuge process. So yeah, you can continue your daily life as per normal once you've had the procedure done.
Yeah, it doesn't take a great deal of time, does it?
No.
You're not in the clinic for that long.
Absolutely.
Yeah.
So Alina is now going to prepare the blood in the sense that small injections are going to be prepared for the serum, and then obviously conducting the procedure in accordance with medical practice. So she's now wiping any leftovers from the cream, making sure that the skin is all nice and ready. Marta?
Tutaj widzimy, że procedura naszego zabiegu zaczyna nabierać kolejnego tempa, czyli krok drugi, zmycie kremu znieczulającego, a następnie już tutaj mamy odwirowany produkt fibryny bogatopłytkowej i-PRF, który zostanie kolejno podany w skórę w celach terapeutycznych. Istotą tego zabiegu także jest szybkość podania, ponieważ z tego względu, że tak jak wcześniej wspominaliśmy, produkt jest dość gęsty, musi być szybko podany.
Musimy chwileczkę czekać. Wykona się suplementację odpowiednio.
Tak, tutaj jeszcze chwileczkę poczekamy, aż nam te wszystkie elementy morfotyczne opadną na dno, z tego względu, że są cięższe niż osocze, one właśnie opadają na dno próbówki, więc musimy chwileczkę poczekać, aż nam tutaj pojawi się wszystko tak, jak być powinno. Widać, że pani się nawadniała przed zabiegiem, bo jest dosyć sporo produktu. Jeśli chodzi właśnie o zalecenia przed zabiegiem, ważne jest to, aby uprzedzić pacjenta wcześniej, aby wypijał około co najmniej te 2 litry wody dziennie, aby unikał przyjmowania aspiryny, leków przeciwzapalnych. No jeżeli ma ktoś skłonność do zasinień, to zalecamy też stosowanie kremu z witaminą K przed zabiegiem.
So there we go. It's you can see from here that there's the separation in the blood cells.
Yeah, we need to wait a little bit.
Yeah, all good. There we go. All the good stuff at the top.
Absolutely.
Perfect. So the next stage then is...
So it's to fill in the syringes ready for application.
Yeah.
That's the next step that will take place. And the practitioner, the medical practitioner, will follow a kind of a roadmap through the procedure. So if they are injecting on the face, they will start on symmetrical points. You know, there will always be symmetrical points across the left and the right of the face to make sure that they inject the right amount in the right position. So you will see that Alina will be kind of going through the steps in a very methodical way, so that she matches the quantity injected on both sides of the face.
I think it's an important point that everybody at Ascroft Medical that delivers the procedure is fully qualified and medically trained.
Absolutely, yeah. Ascroft Medical is a Care Quality Commission registered practice, and all our doctors are GDC registered as they have to. So they not only are registered in their fields of medicine, but we have quite a number of specialists from gynecology to implantology in terms of dentistry and so on. So we are both medical and dental practice. Yeah.
Yeah. Excellent. There we can see
Pokazywany jest teraz sposób pobierania produktu fibryny do strzykawki.
It's all gone quiet as everybody's
Jak
watching.
Jak widać, duża zawartość krwi, pomimo dużej zawartości krwi naszego produktu nie ma za wiele, ponieważ tak właśnie wygląda prawidłowa fibryna przy jednocześnie właśnie tutaj dobrym nawodnieniu naszej pacjentki i sposobem podania będzie właśnie też szybkość, aby nam nie zgęstniał ten produkt.
The fact that we said earlier that you should expect to see about 3 ml of product at the end of the centrifugation process, it all depends on the patient's blood. It's not, this is not exact science. It depends on the patient's type of blood and then our medical conditions and so on. So that's 175? Sorry, 275? 175. So that was just from one tube at the moment. So that's a perfect example. Obviously, there's clinical studies, and the clinical studies kind of tell us how much we can get from the different experiments that are done, but then each patient is a different one, and each case is a case. The important thing is that from the 13 ml you will definitely obtain a good sample that's enough to do a small area. And if you require a large area of the skin done, then of course more blood has to be taken so you can obtain more iPRF. Marta, I don't know if you'd like to perhaps take through what I just said in Polish in terms of the quantity of fibrin and the different patients that we may have.
Tutaj w zależności też od tego właściwie zawsze pobieramy te 2 próbówki do tego zabiegu i po prawidłowym odwirowywaniu właśnie zostaje mała ilość tego produktu. Alinko, ile dokładnie było tego? 1,75, tak. 1,75 z próbówki 13 ml. Teraz jest pokazany sposób podania w dolinie łez.
So how many times would this treatment, how frequently would somebody, it's not a one-off treatment, is it?
No, absolutely not. Like with every treatment, is something that you should do over a course of time. And there are indicative studies of a number of applications, 3 to 4 applications, separated by a period of about a month, 28 days roughly. That's what's out there. I think it's important to realize that always take clinical advice, always follow the advice that you get given, because each one of us is different. Each one of us may have different needs, different conditions, and what we're trying to achieve. It's important to know that the procedure that Alina is doing now, of course, we've got our patient Louisa, she's a female, and she's doing it on a particular side of her face. But if you had a male patient, and it was for alopecia, and it was for an increased level of baldness, then of course the quantities and the time scales and the repeated numbers of times you should have the treatment may vary. You may do it for a year, 2 years. It all depends, as I said, on what your clinician will recommend for you to do.
W zależności od indywidualnych predyspozycji, od indywidualnych potrzeb skóry, wykonujemy średnio zabiegi w serii zabiegowej od 3 do 4, średnio w odstępach co 28 dni. Oczywiście wszystko zależy od tego, jak osoba wykonująca zabieg poprowadzi pacjenta i dobierze odpowiedni okres pomiędzy zabiegami, pomiędzy tym, kiedy powinno się powtórzyć kolejną kurację. Natomiast średnio jest to zawsze 3-4 zabiegi w sesji. Też w zależności od tego, w jakim mamy styl życia, jaką mamy pielęgnację. To też zależy od tego, ile tych zabiegów należy wykonać, w jakiej częstotliwości, w jakich odstępach, dlatego osoba, która wykonuje zabieg, wraz z pacjentem podejmuje tę decyzję, jak ta kuracja ma wyglądać.
I think in terms of how people perceive aesthetic medicines and not that kind of thing. I mean, there's different types, obviously, but one of the great things about this is it totally is natural. It's literally using your own body to heal your own body. There's nothing else other than your own goodness, which is great.
I think that's the key element of a procedure like this. You're not injecting anything that your body can reject, because you're injecting something that your body knows very well, and that's what's circulating in the blood vessels. And that's the attractiveness of these procedures against any other procedure that you may consider. And the popularity of i-PRF recently across the medical sector and due to the clinical studies is certainly one of the factors why many people nowadays consider i-PRF as effectively, as you said, the future in terms of these treatments. And I'm sure we'll cover later on the benefits and the differences between this particular treatment and other treatments. So I'll leave that for later, Matthew.
Teraz jest pozyskiwana druga probówka. Jak widać tutaj okolica oka, dolina łez jest już wykonana. Jakie odczucia? Jak się Pani czuje?
Bardzo dobrze.
Okej.
Nic nie boli.
Prawidłowo. Teraz kolejną partią będą bruzdy, tak? Bruzdy wargowo-nosowe.
I think on the question, sorry, Marta, on what you were saying a moment ago, Xiao, is there anyone who this treatment isn't suitable for, even though it's natural things going back into the body, it might not be perfect for everybody?
I believe there are particular types of patients. I think we were talking earlier on today, if you're breastfeeding or pregnant. So there are some areas where perhaps you should always seek medical advice first. That's what I would say. Like I said, each patient, each condition is different. But these are just two examples. If you are anemic, is another example. Of course, anemia means that you have deficiency in red blood cells. What you don't want is to go and take blood for a procedure such as this, only for an emergency. So always seek medical advice in these instances to understand, so that your doctor understands what are your medical conditions, what is your medical history, and then act in the most appropriate manner so that the treatment is safe and of course offers you the intended outcomes that you are looking to achieve from it, whether it's for the treatment of alopecia or whether it's for rejuvenation. These are the things that you need to bear in mind.
Jeśli chodzi o przeciwwskazania do wykonania zabiegu, to przede wszystkim osoby, które mają problem choroby krwi, są tutaj nie są kwalifikowane do zabiegu. Mówię tutaj o na przykład małopłytkowości czy anemii. Kolejno przebyte choroby nowotworowe, ciąża, karmienie piersią, wszelkie infekcje wirusowe, bakteryjne, grzybicze, opryszczki, ogólnie stany ropne na twarzy, na skórze są przeciwwskazaniem do tego, aby można było wykonać tego typu zabieg, jak również choroby autoimmunologiczne. Tutaj produktem podawanym pod skórę jest nasz własny autologiczny produkt, więc staramy się, żeby to wprowadzenie ponowne miało faktycznie cel terapeutyczny, więc osoba do tego zabiegu musi być zupełnie zdrowa, aby osiągnąć jak najlepsze efekty.
Now, obviously, alopecia can affect people at different ages, hair loss can happen any time. But when it comes to the skin, is there an age when this kind of treatment would become effective? It's not something that younger people, for example, might need to have.
Yes, I think the moment that your collagen levels start getting lower in your body with age, I think that's the right moment when treatments like this are perhaps, from an aesthetic point of view, they have the desired outcome. That outcome is not just about your physical appearance, it's also about your psychological health, your mental health, because that affects the way we perceive ourselves and the way we live life. So I think the key indicator is, when you start to see your first wrinkles, maybe you're a smoker and you want to better your appearance and you're still smoking and you shouldn't. It's just an indication, a relative indication. I don't think there is a particular age at which you're advised not to or to. And again, I would always seek medical advice for these circumstances. But when you feel that you can better your appearance and your image is perhaps not as you would like it to be, that's perhaps the right time to consider these sorts of treatments. And it's all ages, all people, in my view.
Jeśli chodzi o zakwalifikowanie pacjenta do zabiegu, poniżej 35 roku życia zalecamy takie zabiegi bardziej jako zabieg profilaktyczny, przeciwstarzeniowy, ale także w celu nawilżenia skóry, zagęszczenia jej. Oczywiście po 25 roku życia zaczynają się już procesy starzenia niestety, ale już po tym roku dobrze jest wzmacniać tą barierę skóry, aby ją prawidłowo nawilżać, odżywiać, żeby później miała jak najdłużej, zachowała swój blask, więc właśnie od 25 do 35 roku życia kwalifikuje się takich pacjentów jako profilaktyka przeciwstarzeniowa. I tutaj w tym przypadku dobrze jest wykonać tę serię zabiegową, ale odstęp pomiędzy jej zakończeniem a kolejnymi zabiegami jest na pewno wydłużony. Nie trzeba powtarzać ich tak często jak w przypadku osób, które już te 35 lat ukończyły. Wtedy już warto mocniej postymulować te komórki, postymulować skórę, zagęścić ją, więc po serii 3-4 zabiegów dobrze powtórzyć tą kurację kolejno po 6 miesiącach.
So as you can see, Alina has finished the procedure. How are you feeling, Louisa?
I'm feeling good.
You're good?
Yeah.
How did it go, Alina? Sorry, how did it go, Alina?
Very well.
Yeah, it seemed to go very smoothly from over here, so that's good.
Absolutely. Louisa is looking great, I have to say.
Yeah, so relaxed, taking it all in a stride.
I know, fantastic
No
patient to have. Thank you very much for coming, really. Absolutely, yeah. I think that's a good indicator always, yeah. Her skin is looking very radiant at the moment.
Absolutely.
Yeah, yeah.
Jeszcze może powiem o zaleceniu po zabiegu, co Pani powinna... Ja może przekażę tutaj właśnie, że po zabiegu warto tutaj zawsze pacjentom uświadomić, żeby unikać słońca, sauna, solarium, rozgrzewanie silne skóry. Jeżeli wychodzimy na dwór, to nakładamy krem z filtrem przeciwsłonecznym. Właściwie to powinniśmy codziennie używać, niezależnie od pory roku. I jeżeli są właśnie takie skłonności do zasinień, to można aplikować krem z witaminą K czy z arniką. I tutaj łagodnie z buzią się obchodzić przez najbliższy czas. Najlepiej jakby przez 12 godzin nie nakładać makijażu, żeby tutaj te mikronakłucia zachowały jak największą sterylność. Więc czekamy na efekty teraz.
Martha was saying, the post-procedure is very important, that the patient looks after their skin, so not to expose themselves to sunshine just after the procedure has been complete, not to go to a solarium or a sauna, or to expose their skin to radiation, not to wear makeup, because obviously you've just had the procedure done, don't want this to go and infect your skin with makeup. So it's a delicate procedure as well. You know, we're talking about the skin. The skin is exposed to the elements of the environment, and some degree of care needs to be exercised in at least 24 hours to 48 hours to make sure that it heals nicely, to make sure that you obtain the best results. So that immediate care is important after the procedure.
Thanks. And before we wrap up, I'd just bring up the promotional prices that we have on this, and people know just how much it costs. We do have a promotion on until the end of next month, until the end of October. The prices are up there on the screen for people to view. And like you said before, it's an ongoing procedure, so people need to bear that in mind. But obviously, it's advisable to get in touch with those at the clinic and speak to somebody about it initially and arrange a consultation and take it from there to decide if this is an appropriate treatment for you. That's obviously the most important thing. So before we wrap it up, I'd like to thank everybody for getting involved, because of course this was my idea and I had to drag everybody in to do it, and everybody's been very good sports about it and very, very cooperative and very, very brilliant and professional. And thank you, Louisa, for your time. I really appreciate it. Thanks very much. Alina and Marta and João, thank you all very much indeed for coming along this evening and doing that. I hope if you've been watching that you've learnt a lot, and if you've still got questions, you can always get in touch with us at Ascroft Medical. We'd be absolutely delighted to help you. So thanks very much for watching, and enjoy the rest of your evening. Thank you,
Matthew.
Much.
Thank you.
Pleasure. Thanks a lot.
Bye-bye, everyone.
Bye.
Bye.